Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a January 25th, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 case total is over 11,600 individual cases, with 518 cases reported in the last 14 days, which is increased from the last 14-day period I spoke about. All age groups are experiencing new cases, with the 18 to 29 age group accounting for 22% of the cases in the last 14 days. Our 14-day positivity rate remains steady at 10% as the trend line of new cases once again is going up. Meanwhile, over 1,220,000 cases and over 21,500 deaths have occurred in the U.S. in the last 7 days. Those numbers are also higher than the 7-day period I reported on last week. These increases are happening as we're just starting to detect the SARS-CoV-2 variants here in the United States. Iowa is also monitoring for these variants, but has not yet found any. Just to give you an idea of how much they have affected other countries, in the UK, the B117 variant has caused a rapid surge in cases. Ireland alone is having one of the fastest outbreaks, where the B117 variant went from 9% of the cases on December 20th to 45% of the cases on January 10th. A recent peer-reviewed study in the UK showed that the B117 variant was 75% more transmissible. And although the vaccines appear to be effective against these variants, and they are not totally unexpected as the virus continues to change during transmission, the variant first detected in South Africa, 501YV2, and P1 variant first detected in Brazil have both heavily affected those countries' increased rates of infection also. Dubuque County continues to receive vaccine from the Iowa Department of Public Health and is now completing Priority Group 1A with over 7,600 doses administered. The Iowa vaccine shortage order allows us to start moving into Phase 1B upon completion of healthcare worker vaccinations. Plans are underway with our local vaccine providers to vaccinate those in the newly determined 1B priority group. February 1st is the Dubuque County Incident Management Team's goal. However, due to unknown vaccine allocations and supply, that date is not a guarantee. Vaccine allocations and availability will also influence where the vaccines are allocated locally. The Incident Management Team intends to follow 1B's Tier 1 guidance and start with residents age 65 and older for 50% of the vaccine allocation, and first responders and pre-K through 12 school personnel for the remaining 50% of the vaccine allocation. The goal is to finish Phase 1A, or the healthcare workers, this week, and begin Phase 1B sometime next week or later. As we work with local healthcare and school partners to begin Phase 1B, we continue to have multiple planning challenges. First of all, our unknown vaccine allocation. Secondly, we don't know the exact date of when the vaccine will arrive, which makes it impossible to start making vaccination appointments. Thirdly, the Biden administration will be making decisions regarding the National Pharmacy Partnership execution and other COVID guidance issues. And lastly, we will continue to have state-level guidance changes from the Iowa Department of Public Health and/or the Governor's Office. For example, just last week, the state changed priority group to add those 65 years and older, when just the week before it was 75 years and older. Now, we won't get enough vaccine for all in those groups immediately, so even this first tier of Phase 1B will take several weeks to get through. So as the vaccine rolls out and you're thinking this is going to return us to normal, don't make normal plans too soon, because the ability to transmit the virus after vaccination is unknown, and because it takes about a minimum of 2 full weeks after your second vaccination dose for the vaccine to be 94 or 95% effective, all the public health measures must still continue. So until you and the majority of others get vaccinated, here's what we have in our armory. mask wearing, everywhere you're around others outside your immediate household, social or physical distancing, which is maintaining space between yourself and others, hand washing, not going to school, work, or other places when you're sick or have been exposed to someone with COVID, and finally, and just as important as all the things I've mentioned, is testing. Testing when you have symptoms, even if you think it's just a cold, test following exposure to a positive case, or even after you've been in a risky situation where others were not following public health measures, like not wearing masks. Testing is still available at our 2 Test Iowa sites, and information on how to schedule is available at testiowa.com or the city or county websites. Testing is so important, especially following an exposure. The CDC recently did modeling that showed more than half of all coronavirus cases were transmitted from people with no symptoms. And another research article funded by the National Institutes of Health published last week looked at many data sources, studies, and reports of mass screening for the coronavirus. This study concluded that the data suggest at least 1/3 of infections are asymptomatic, meaning people never develop, perceive, or report symptoms. All the more reason to keep wearing a mask. As we close today, keep in mind our ever-changing COVID-19 situation, and as we realize we are not going to return to normal for quite some time, I ask you to reflect on a couple of quotes I came across. The first from Steve Maraboli. Life doesn't get any easier or more forgiving. We get stronger and more resilient. And as we press on through this week, keep in mind what author Kate McGahan said. I've got some bad news and I've got some good news. Nothing lasts forever. Hang in there, Dubuque County, and stay safe because we're all in this together.